Hello everyone, my name is Taylor Hall, and today I am presenting a science highlight for Nutrition 5110. I will be discussing ketogenic diet for endometriosis symptoms. This discussion is from a 2025 study titled MCT Modified Ketogenic Diet as an Adjunct to Standard Treatment Regimen Could Alleviate Clinical Symptoms in Women with Endometriosis. The study was published in the BMC Women's Health by Nayini and colleagues. Here is our outline for the science highlight. I've organized the presentation to first cover the pathophysiology of endometriosis and the biochemical rationale for the ketogenic diet. We will then take a look at the specific 12-week clinical trial design, the results regarding pain management, and finally, the limitations and big picture takeaways for future research. As quoted by Ellis and colleagues in an article published in Frontiers in Global and Women's Health, endometriosis is a chronic inflammatory condition where uterine-like tissue grows outside of the uterus, affecting about 11% of women. It is driven by estrogen signaling, oxidative stress, and systematic inflammation. The initiation, based on current available evidence, comes from the WNT beta-catenin signaling pathway. This pathway will be discussed further later in the presentation. Endometriosis is said to be the most perplexing gynecological condition affecting women of reproductive age. It can manifest infertility, chronic pelvic pain, severe menstrual periods, dyspareunia, bloating, and constipation, according to Nayini and colleagues. Let's break down what the ketogenic diet is. The premises is to reduce total carb intake in the daily diet. It aims to reduce of carbs to only 5 to 10% daily, while raising daily fat intake to about 70 to 80%. This also includes lowering protein intake daily to about 10 to 20%. I do want to note that there are a variety of versions of the ketogenic diet, but this study does focus on medium-chain triglycerides, or MCT modified diet, which will be further discussed on how they achieved this later on in the presentation. The goal of the ketogenic diet is to lower the blood glucose levels and increase ketone bodies in the system as an alternate energy source. Previously, there has not been many studies that focus primarily on the ketogenic diet and endometriosis. There has been some focus on mice with colorectal cancer and the keto diet and a systematic review. So, the purpose of this specific study was to see if an MCT modified keto diet can serve as an adjunct or an addition to standard hormone therapy. Biochemically, the theory is that higher ketone levels and lower blood glucose levels suppress the WNT beta-catenin pathway, as mentioned in the previous slide, essentially starving the inflammatory process. So what kind of effect could the ketogenic diet have on endometriosis? Physiologically, the study was looking at the WNT beta-catenin signaling pathway. In this disease, the pathway is essentially in overdrive and overactive in the endothelial tissue. This prevents natural cell death or apoptosis and allows these lesions to survive and grow outside of the uterus. The ketogenic diet is said to suppress this signaling pathway by inflicting ketosis in the body. We will now dissect the study and how they achieved the results. This study was a 12-week randomized controlled trial done in Tehran, Iran. The researchers recruited 50 women ages 25 to 35, all with stage 1 or 2 endometriosis. This was confirmed by laparoscopic surgery or by pathological findings based on patient histories and interviews. Their BMI ranged between 21 and 25 kilograms per meter squared and had a VAS score of 3 out of 10 or under for pelvic pain and dyspareunia, A VAS scale is used to determine pain intensity across a 100 millimeter line. Table 1 demonstrates the baseline characteristics of the subjects in the study. Within the study, the intervention group, which included 25 of the subjects, followed a 3-to-1 fat-to-carb protein ratio. They specifically used 500 cc's of the medium-chain triglyceride oil as a primary fat source. This would be used as dressing on a salad or sometimes mixing in with their drinks. And this was also used alongside their standard oral contraceptives. Rice bread, sugar sweets, potatoes, pasta, and dairy products were all prohibited to help maintain their ketogenic diet. Now the control group, which also included 25 of the subjects, remained on oral contraceptives but also followed their regular diet. Supplementation was continued to have taken to help maintain a healthy homeostasis. Multiple measurement tools were used in the study, including a 3-day recall questionnaire, which was taken every 2 weeks, dietary urinary ketones in the first 2 weeks, and then weekly using a ketone strip. Anthropometric measurements, including body weight and waist circumference, was taken every 2 weeks, and laboratory tests were done to measure total cholesterol, LDL, HDL, and others. Let's break down the results. I've included Table 3 from the article, which demonstrates the biochemical parameters before and after the 12-week study. This also includes the p-values. With the 50 enrolled, 44 completed the study, with 19 in the intervention group and 25 in the control. There was no significant difference in weight or BMI or waist circumference post-intervention, with a p-value of 0.05. I do want to highlight the serum AST, or aspartate aminotransferase levels, which is an enzyme found in the liver, heart, and muscles. This is measured via blood test to check for tissue damage. Elevated AST levels can indicate damaged tissues, but this was significantly reduced within both groups. The table demonstrates that there was no significant difference in the blood panels and includes a p-value of 0.05. I do also want to highlight the total cholesterol p-value in the intervention group was 0.04, which could be significant. To continue with the results, I have included Table 4, which demonstrates clinical symptoms of subjects before and after the 12-week study. We can see, based on the table, dyspareunia was reduced in the modified ketogenic diet compared to the control group with a value of 0.02 p-value, which is pretty significant. The constipation was also significantly reduced in the ketogenic diet compared to the control of 0.07. And then with pelvic pain, this was also reduced in the ketogenic diet compared to the control. Let's discuss the discussion and the summary, including some limitations and possible future recommendations. The big picture here is that the MCT keto diet is a viable adjunct therapy for early stage endometriosis pain. However, we must note that there were limitations to the study. The study had a small sample size, including the 44 finishers, a very narrow BMI and age range, and it did not include stage 3 or 4 endometriosis. Furthermore, they did not measure specific inflammatory biomarkers, which could have confirmed the biochemical shift they theorized. If we were to further our research in the future, we would want to aim for a greater sample size, maybe try to enroll patients with all stages of endometriosis, and include inflammatory biomarkers as a measurement tool for the study. Thank you so much for taking the time to listen to my Science Highlight presentation. I've included my references from my research, and I am looking forward to further discussing this on our Canvas board.